Everyone, so today we are doing this immunodeficiency disorders. So I have made a list of all the PYTs. So we'll discuss like number wise. Like today, this is the third topic I've chosen as a PYT. This was this year question. So we'll go through this immunodeficiency disorders. So we'll start with this line diagram. So here we have to understand this in immunodeficiency disorders. We have these B cells which are providing us humoral immunity. Humoral immunity. So we'll study initially. We'll study this B cell disorders. Then we'll go with T cell disorders. B plus T also. Okay. So initially we have this pro B cells. We have to remember this. We have this pro B cells which is converting into this mature B cells. And how it is converting? With the help of this BTK. BTK. So that is this Bruton tyrosine kinase. And then this mature B cell is converting into plasma cell with this BAF, and then ultimately it is converting into IgA. So first disease we will study is Bruton A gamma globinemia, which is the X-linked A gamma globinemia. So here what is happening? We have to remember that this is the BTK gene mutation. So this tyrosine kinase defect that leads to that there will be no B cell maturation. No cell will get mature. So here it is written, after 6 months, absent immunoglobulins, all absent germinal centers and tonsils. What does it mean? So Bruton ka the mnemonic is all things are starting from BBB. So it is Bruton B cell disorder. Boy, male infant is involved, and after 6 months, why after 6 months? Till 6 months, baby has maternal immunoglobulins. So once maternal immunoglobulins start waning off, so this start the presentation start. Okay, now how does baby present? The infant will present with recurrent bacterial enteroviral infections. So here we have to remember there is no mature B cell, nothing is formed. So absent tonsils, absent lymph nodes, absent germinal centers. That's why this is Bruton A gamma globinemia. So buzzword will be here will be used is no B cells, no immunoglobulins, no germinal centers, and inheritance is X-linked recessive. Next we have next B cell disorder. So one thing we have to remember that this is like severe, this is like moderate, this is mild. Okay, so here this is common variable immunodeficiency. So here the defect is this B cell differentiation into the plasma cells. So now we have mature cells in the body, but they are unable to convert into this plasma cell, which ultimately is responsible for conversion for formation of different immunoglobulins in the body. So how it's what is this like why it is happening? Due to this BAF mutation. So onset is here, the onset will be adolescent. That's why I call it little better than this previous one. Adolescent, young adult will be present. Clinical presentation will be recurrent sinopulmonary infections and has increased risk of autoimmune diseases and lymphoma. And when we check the labs, so nothing is this plasma cell wala step to is not happening now. That's why there is decreased immunoglobulins of the all classes. But when we see this normal B cell count, that will be normal. This mature B cells are normal, but this is not, the formation is not here. So that ultimately there will be decreased immunoglobulins of all the classes. So here the buzzword will be late onset hypogammaglobulinemia, autoimmune risk. Now third condition, third B cell disorder, we have selective IgA deficiency. So for this we have to remember that this is the most common primary immunodeficiency. This is the most common primary immunodeficiency, and here the features is often the patient is asymptomatic. If presentation is there, that is with recurrent mucosal infections, that is sinopulmonary or GI infections like giardiasis, atopy, asthma, autoimmune diseases. And one thing here is important, this transfusion reaction is seen in this condition because of the anaphylaxis to the IgA containing body products, because patient has this IgA deficiency and will have these antibodies to the IgA, and when will get this blood, then body can show the anaphylaxis to the blood products containing IgA. So buzzword will be giardia and anaphylaxis blood transfusion to the blood transfusion. This we have done. Now this Biscott Eldridge syndrome, Job syndrome, Digeorge syndrome, SCID, Chidiac-Higashi. We'll do this all and see later on. We'll see which one is B, T, B plus T. So Biscott-Eldridge syndrome, the triad here, you have to remember the mnemonic is Biscott-Eldridge, Visco, Biscott, whiskey, whiskey के साथ with water. So remember whiskey, water, Biscott, Eldridge, thrombocytopenia. Thrombocytopenia, low platelet size, fatigue and bleeding, eczema. Eczema, there can be bloody diarrhea often present, and recurrent infections that are opportunistic. Immunoglobulins, when we'll see, the IgM will be reduced. There will be reduced IgM levels. Rest IgA, IgE will be high, and normal IgG. This we have to remember. And inheritance is X-linked recessive, and mutation is in the VASP gene that leads to defective actin cytoskeleton. So buzzword here will be small platelets, eczema, infections, and high yield is fact we have to remember that increased risk of lymphoma and autoimmune diseases. Second condition we have Job syndrome, that is hyper IgE and STAT3 deficiency. So mnemonic is fated. So we can remember it like most of us are fated to do a job, right? So fated में F is facies, that can be coarse. A, abscess. Abscess we have to remember is cold. So we can remember this way, like in our workplace, more people, like most of the people are more reserved or cold, and only few people are warm, open type. So remember most of are cold. So abscesses at job is cold. That means there is no inflammation. There will be defective neutrophil chemotaxis, and why this is because of this Th17 defect. And teeth, everybody show this fake smile there to please everybody. So smile, teeth, will remember retained primary teeth. Eczema and dermatologic infections like recurrent staphylo, candida, aspergillus. We'll see the lab like in job. I should not say this, but maybe like few people don't like each other, allergy type. Okay, you are getting. So they can be raised Ig levels, raised eosinophils levels, allergic people, allergic reactions. Buzzword here can be cold abscess, coarse facies, retained teeth, and job में like this dominant, only that survive. You need to be a dominant. So this disorder is this dominant wala disorder. Di-George ka we have to remember that this is 22q11 deletion, and mnemonic is catch 22. This we know. So we'll go for like fastly here. Cardiac defects, ponotruncal, TOF, truncus arteriosus, abnormal facies, thymic aplasia, reduced T cells, recurrent viral fungal infections, cleft palate, hypocalcemia. Why this hypocalcemia? Because of this 22q11 deletion, there is this congenital deficiency due to this inability to the formation of this third and fourth pharyngeal pouches, which ultimately form the thymus and parathyroid glands. That formation doesn't occur. There will be no PTH, no calcium levels, because PTH is responsible for maintaining the calcium levels, that can present with tetany and seizures. So buzzword here will be no thymus, no T cells, hypocalcemia. This we have done. Now SCID. So SCID ka we have to remember that this is two causes. Most common is X-linked recessive, but least commonly asked in exam. This we have to remember. Interleukin 2R gamma mutation, AR autosomal recessive, ADA deficiency. Presentation how? Recurrent infection since birth, failure to thrive, chronic diarrhea, thrush. Buzzword here will be this shadow, this all like absent thymic shadow, absent germinal centers, and treatment here is like nothing is there. So bone marrow transplantation has to be done, and avoid the live vaccines. Celiac gastritis, we have to remember this list gene mutations that leads to impaired lysosome trafficking. So triad we see here is this pine. Pine में this platelet dysfunction leads to bleeding. Immunodeficiency can lead to recurrent pyogenic infections, neurologic problems, neuropathy, neurodegeneration can be given. Eyes में albinism, this we can see here. Light skin, silvery hair. Buzzword will be giant granules in the neutrophils, platelets on the smear, or here the inheritance is autosomal recessive. Now we'll go with this portion. So here we have this disorder. So we have to remember this first three are B cell defect only, though humoral. So Di-George ka we have to remember this is T cell defect only. For Biscott, Eldridge, ataxia, telangiectasia, SCID, we have to remember this is B plus T. And hyper IgM ka we have to remember, this is B cell defect. Mainly there is this class switching problem with T cell signaling issue, and that is this CD40 ligand CD40 pathway. This is defective, and that's why this MD formation cannot, this IgM cannot be able to convert into other immunoglobulins, so there will be hyper IgM. So SCID ka we can remember like this, that this is the big one, and both B plus T is severely impaired, and sometimes NK cells are also. And now we'll study about the vaccination, because these days they are asking about questions around this vaccination part. So we have to remember one thing, that live attenuated vaccines are contraindicated in T cell combined immunodeficiency. So here we can see all the live vaccines: BCG, OPV, oral polio, MMR, varicella, yellow fever, intranasal influenza, rotavirus. So why? Reason you can see here, why? Because live organism may replicate uncontrolled in T cell or combined effects and lead to fatal infection. So it is contraindicated in SCID, Dye-George syndrome, Wiskott-Eldridge, Texia-telangiectasia, and advanced HIV, because it has low CD4 count. And we have this killed inactivated subunit vaccine, safe, and what may response may be poor. So examples this we can give, like beta hepatitis B, A, IPB, influenza, pneumococcal, meningococcal, Hib, and HPV. So here we say that the safe, but no replication occurs, but efficacy may be reduced in B cell defects. Still we recommend it, since patients are prone to this encapsulated bacterial infections. So this we have done. Okay, now Bruton may we have done this. Mainly everything is contraindicated, ineffective. Only IEB, IG is the treatment. SCID ka we have to remember, everything is useless. No live vaccines until this hematopoietic stem cell transplantation. IgA ka still safe, but only we have to, one risk is there, that is transfusion anaphylaxis risk. Dye-George ka we have to remember, this depends on the severity. Complete form, no live vaccines. So okay, here we can see in short, and this we have done already, okay, we can go through this part also. Now what are we left with is this. Okay, this mnemonics we can go, you can see. And this Wiskott-Eldridge we study like Visco, whiskey, water. And if somebody likes whiskey, we'll still advise him, take small whiskey, small type, so small platelets. Job syndrome ka cold co-workers, and fake smile, retained teeth. We can remember Chidia Higashi ka how we can remember, like C ko we remove with C, so H head, high, HI will, so that means everything is big, so giant granules in neutrophils. And this is also autosomal AR, autosomal recessive. And SCID ka we know, Dye-George ka we know, Bruton ka BBB, or IgA ka anaphylaxis with blood transfusion. This we have to remember, and I think I have covered everything. One condition I left, I forgot to add, was this Texia-telangiectasia, where there is this APM gene mutation. And rest, what are the clinical presentations? I want, like, you tell me what all clinical presentation is with this Texia-telangiectasia. Telangiectasia and Texia is already in the name. ATM gene mutation I have told. Whatever else is important, you tell in the comment box. Thank you.